if you have a clinically diagnosed patients, they were at risk. Somebody's a diabetic, they don't know they're a diabetic. Now the lab order is back there and it's flagged to say, put this person on certain medication to bring down their A1C and sugar levels and stuff like that, was hanging out there.
Corporate fraud works best in the shadows, behind corporate walls. How does the government bring these wrongdoers to justice? Whistleblowers. These are the stories of those who risk their careers to shine a light on allegations of fraud. Today on Fraud in America.
Welcome to today's episode of Fraud in America. I'm your host, Jeb White of Taxpayers Against Fraud. Today, we are joined by whistleblower Brendan Delaney and his attorney, Colette Matzzie of Phillips Cohen. Mr. Delaney brought a False Claims Act qui tam action against electronic medical record vendor eClinicalWorks. We'll discuss his allegations on today's episode. The case ultimately resulted in a $155 million recovery. Mr. Delaney received a whistleblower reward of $30 million. But we go well beyond the numbers on today's episode to discuss Mr. Delaney's allegations, the public-private partnership that worked so well in this case, and how other whistleblowers can step forward to bring similar allegations. That all happens today on this episode of Fraud in America. Well, welcome to today's episode of Fraud in America. As I said, we're joined today by two really inspiring people. One of them is one of my good friends, Colette Matzzie. She's with the whistleblower law firm Phillips Cohen in Washington, D.C., and we're joined by her client, Brendan Delaney. And I think this is a story that's going to resonate with so many of you, but there's some interesting wrinkles to this case and this settlement that probably is going to reset the calculus for a lot of cases going forward. And I never, ever start with the lawyer on this show. But with this case, I am. Why does this case matter? We're talking about EHR and meaningful use rules. It's a little complicated at first blush, but what are the basic allegations here?
Right. So Congress passed a law in 2010 to create a nationwide system of electronic health records and invest in billions of dollars in the hope that hospitals and medical providers would adopt and implement effective and safe electronic medical record systems. And eventually we'd have this super highway of information with all of our medical records, and it would be more accurate and would protect patient safety. So that was known as the High Tech Act. It was enacted in 2010. And Brendan will tell his story, but the basic upshot of the case is that Brendan came to us in 2011 originally, concerned that what he saw was an implementation of an electronic health record system in Rikers prison, which was dangerous. And as we later alleged, it did not meet federal standards, federal safety standards. So the eventual success of the case is that it was the first settlement with an electronic health records company, which made them pay back a lot of the meaningful use subsidies which the government had invested. The settlement was for $155 million, but also made them fix the software, allow people to transfer off the software, and really, it was a breakthrough case for the United States to understand that faulty software can give rise to False Claims Act liability.
Brendan, you were working in 2011 with Rikers Island in the prisoner healthcare, trying to get this system up and running, right? This eClinicalWorks. What did you recognize? What were some of the problems you saw with the system at that time?
Yeah, actually, I was, by default, I was laid off in August of 2010. And then they offered me a job to become an implementation specialist, with the Bureau of Healthcare Access and Improvement at the New York City Department of Health. And the primary goal was they just contracted with this new company, eClinicalWorks, which they had piloted the system, I think, in 2008 in the female jail facility at Rikers. It was now phase 2, and we were rolling out to the other. At that time, there was at least 12, over a dozen clinics. The clinics here at Rikers Island are 24/7. We're very big, very busy. At that time, I believe there was a inmate population of about 12,000.
Wow.
It's diminished considerably thereafter. But so I had to train up, how to use the system, and then in turn be able to write manuals and then go out into the clinics 24/7 and train all the clinicians, from providers to nurses to support staff. The New York City Department of Health were the keepers of the health clinics for Rikers. They contracted a private health firm, at the time was called Prison Health Services, which is it's a private entity, but it's also a profit-making entity. So now you had a combination of people who were eager to have this new system rolled out, so they could clap themselves on the back, and then the Prison Health Services were eager to accommodate them, because unfortunately, being a profit-making entity, this is in my opinion, that it took away from the proper oversight when you rolled out the system. Also, Prison Health Services didn't actually trust the software because they kept paper records parallel to the rollout of the system. I quickly saw there were multiple errors. Some doctors, I have to pat them on the back, even at the risk of losing their own jobs because it was a profit-making company. They came to me with complaints. I see 2 patients in the one patient chart. One was a male, one was a female. I said, wow. So they confused them when they were ordering medications and stuff like that. Yes. I then started to present these glitches in reports, in daily reports, and send them to my boss. But then I realized when the paperwork was subpoenaed, the research indicated that my boss was taking kickbacks. So I knew. I then realized, oh my God, my complaints were going nowhere. But as specific complaints are, eClinicalWorks market themselves as a nice shiny new car, but with all the bells and whistles, but when you looked under the hood, rust covered the rot. And I saw from the get-go that the medication algorithms were all screwed up, particularly when it came to start and stop dates. I then looked at the reports, the background reports, and there were tens of thousands of incidents of where medication had no start date, they had no end dates. And so people were becoming more and more over-medicated. Then there was also, on top of that, there was dosage errors. If a doctor prescribed a specific dosage, when it was filled, it was a higher dosage. Also, the other errors is this system allowed you to prescribe narcotics as a 90-day prescription, which is contrary to New York state law. You can only do a 14-day at a time. So, but one of the most egregious errors was brought to my attention by a psychiatrist. He said, I don't understand why I'm able to prescribe a brand name and a generic name all into one order. Immediately, that's a flag that you're overprescribed. Every day was the same. And Rikers was more prominent because you had multiple appointments in one day. A patient would go to see a regular doctor for pain medication or some ailment, but he or she would already be booked in to see a surgeon, or a dentist, or a mental health clinician. So if they were seen out of context, if they had a 9 o'clock appointment with the regular doctor, but they missed that one, and then the next one was with the knee doctor, that would impact the actual medication in the system. And then, you always had issues with interfaces and stuff like that. Then the real other serious issue was everything is driven by code. So you have a drug that has a FDA 10-digit code. Some of the compendium or tables in that database were obsolete. So they weren't in line with the FDA. So when something went to the pharmacy, you could get a wrong prescription. That's how serious it was.
That was a major.
When you talk about lab, you go in there, and I was shocked. Now, this is across the board. I mean, this was systemic. When I left Rikers Island, I'm talking about nationally.
Yep.
You had thousands of mismatched lab orders, and the results were hanging out there. If you have a clinically diagnosed patients, they were at risk. Somebody's a diabetic, they don't know they're a diabetic. Mm-hmm. Now the lab order is back there, and it's flagged to say, put this person on certain medication to bring down their A1C and sugar levels and stuff like that, was hanging out there. So a person could be seriously harmed by that. And what I found nationally was clinics did not have the resources to reconcile the huge number of labs that were hanging out there. Mm-hmm. Again, we had interface issues because a lot of these clinics throughout the nation, they were using external clinics, BioReference and Quest and stuff like that. Yep. So everything would be sent electronically out to that lab. But when the results came back, there was some minor error. It could be an initial of a patient's name, the doctor's first name could be wrong, and it would just hang out there. And that was really, that to me, again, a showstopper. Then we had digital imaging. You have paper versus electronic records. The system wasn't configured properly.
And one of the things you did was reach out to Colette. What made you pick up the phone or go to the website to actually reach outside of the corporate walls and do something?
I realized that the city government, the Inspector General's office, did nothing about it. And I also reached out to other entities within the city and got nothing. So I said, okay, I'm going to try this. I just Googled stuff. I realized then there are some options here. So, and then we met together, and that's what I think when Colette said, before she sat down, the poor lady, I said, someone's going to die, and unfortunately they have.
When Brendan brought me all of this, I think when we first met, even before we sat down, you said to me, Brendan, someone is going to die. These are very serious patient safety issues. And, there were regulations and there were standards, and it appeared that they were, that eClinicalWorks was in violation of those, and that Medicare would not want to pay subsidies for a system that didn't meet federal standards. So on that basis, we brought a federal lawsuit in 2011. And unfortunately, as Brendan can also tell you, we could not get anywhere with that lawsuit. At the time, there was a series of things. Some of it was doubt that software, how could that be a dangerous thing? Don't you just download and they fix it and there's a patch and everything's okay? Like, how could that be? There was that. There was the fact that the government really wanted this program to work and they really didn't want to hear that it was dangerous or that it wasn't working. New York City really didn't want to hear it. Brendan filed a claim with the Department of Investigations, which went nowhere. We couldn't get anywhere with the state, the city, anywhere. So eventually we concluded that the case couldn't really go forward without government support. And in 2013, we dismissed the case voluntarily.
Wow.
And without prejudice, which means you can bring the case back. But as you know, Jeb, and I'm sure Brendan, as you know as well, that's really never done. Usually you dismiss it, that's it, it's gone, even though technically you can bring it back.
No, so just make sure I understand the dates here. So 2010, you left, you came back in 2011. to help implement. And then around 2013, you filed.
2011 we filed. Yeah.
Filed in 2011, voluntarily dismissed in 2013.
Correct.
So now we're at 2013. Okay,
right.
great.
Do you want to tell what happened to you before we brought the case back, Brendan, what those years were like?
Yeah, unfortunately, but when I started to work there for the New York City Department of Health out of Rikers Island, my wife was diagnosed with stage 3 breast cancer, and I was trying to still work out of Rikers and still try and document stuff. Now, I did not have a clue what whistleblower was. All I noticed that patients were in danger. So I documented everything. When I realized my boss was doing nothing about it, I decided to bring that very same information to the New York City Department of Investigation. And it was a waste of time, complete waste of time. I actually felt that my boss at the time was on some sort of a take. And I actually mentioned to the investigators, it would behoove them to, tag onto his emails so that they can see the interaction between him and eClinicalWorks. Then I Googled whistleblower and Phillips Cohen came up. And I just filled in the pro forma and I got a call from Colette. What I presented to them was very interesting. She would like to know more. And then we ended up meeting in New York City.
Yeah, what led to you refiling the case? What was the thing that said, we got to refile this?
So I can answer that quickly. So let me just say it was very disappointing when we had to dismiss in 2013, and one of the government lawyers said to me, "There's just definitely something wrong here with the why New York doesn't care about the fact that it has this terrible system. I don't know, but we later learned." Anyway, in 2015. I received a call from an assistant United States attorney in the District of Vermont named Owen Foster. And he called me and said, "Hello, I am up here representing the United States in a lawsuit against the United States for a medical malpractice case that occurred in a federally qualified health center here in Vermont." A woman, Annette Monticelli, came in. She had what later was learned to be an aneurysm. The doctor at the federally qualified health center went to order an MRA, an imaging. It never went to, the order never went to radiology. She left without it, without even knowing that, she was supposed to do it. And she died within a couple of months. This was all she had died. And they turned around, her husband, we've since become friends actually, because he reached out after Brendan's case settled. And they sued the United States. And so Owen Foster is defending the United States. And he said to me, the doctor I have who works for this federally qualified health center is swearing to me up and down that she placed this order. And she doesn't know why it went through. And I've been looking at some of the records, and I'm a little concerned that it looks like something's maybe happening on the back end of these medical records in the cloud, and I'm going to investigate this. And they said, "I did some research, and I found your case. Why did you dismiss? It looks like a good case. It looks like you found all kinds of things, like your client knows all kinds of things." And I said, "Well, no one was interested in hearing from us, but I think it's great, if you are now paying attention to it." And so I hung up, talked to my partners, called Brendan and said, "Hey, what do you think of doing this very unconventional thing?"
Very unusual, yeah. Yeah.
And bringing a new case in the District of Vermont. I think we warned Brendan, the government might say, "Too late, you're done, don't come back," but what do we have to lose, right? So, and at that time, Brendan had been in multiple locations and had seen eClinicalWorks problems in multiple locations, including Boston Children's Hospital. And so we filed a new complaint that was stronger, it had multiple locations, and we filed it in the District of Vermont. And I'll let Brendan tell, but that's how we got back there. It was a combination of sort of, let's just take a leap. Let's see if we can do something, and what do we have to lose? And it turned out we had a lot to gain from coming back at this moment. Yeah.
I am so glad that, Colette and her team jumped at it straight away. You see, there's two types of electronic health records. One is for an ambulatory, which is clinics, just regular visits, daily visits. And the other is an inpatient facility. What really, really stuck out for me was they were using this ECW, which is an ambulatory system, and the inpatient system at the North Infirmary, which is a hospital where all of the patients were critically ill. It couldn't cope. And I was the one that was managing that rollout. So I had to send all of these daily reports in here and the terribly concerns of critically ill patients not getting the treatment that they deserve. That's what really kind of urged me to go somewhere else, to see, can I get somebody else? And even though I was very stressed out between my wife being sick and always the chance of losing your job, it was horrible. And then when I did leave, the Department of Health, and I went on to, the private companies on consulting, and then I rolled out the system across the country, and it was consistent, the same issues. Oh, they'll always blame the user. And that was the mantra all of the time. But in this day and age, particularly now with younger people, they're really computer savvy. You can't tell a younger person today, you don't know what you're doing. No, that's not the case anymore,
So this has been a big change. Anybody that owns a computer recognizes that things go wrong with electronics. But you identified a systematic problem that was happening across different health systems, right? It was actually a problem with the software itself.
One of the major points, initially when we re-engaged, with Owen Foster, there's only a handful of people that I gathered that I put in the category of the most decent human beings on this planet. Owen Foster is one of them. And I'm proud to know him because he cared. He really, really cared. What caught me was when I started to, when Owen started to subpoena the documents, the first batch of documents I got, I believe it was about 180,000 files, that was on a flash drive that Colette had sent to me. And I nearly died. I said, wow, I had to, eyeball every single document in that. And then, in fact, believe it or not, within the next 2 years, from 2015 to 2017, I looked at 5.5 million records.
Wow.
Part of the difficulty was, okay, we've got software and it's bad. We can all stipulate it's bad and that there are thousands and thousands of tickets that they open and close without fixing. But how do we actually say this was a fraud scheme, right? And key to that was the evidence that Brendan and Owen and Owen's team, developed, and our team, to show knowing cheating of the certification process for the software. So Congress set up a process where you have to say you have certified EHR technology as part of the basis of getting federal funds. And when we could show that they had said they had certain codes, RX norm and SNOMED codes, which are critical to safe prescribing of medication and safe diagnoses of patients. Those codes that Congress had, the agencies had mandated, they said they had them, they didn't have them. Later, and they knew it, and there were internal email where, we didn't put the codes, we just cheated. So it was sort of like this. If you have to have software that speaks Spanish, and so the test is only going to require you to have 9 words, they hard coded in what they had to do to pass the test, but they didn't download the whole table. So you can say 9 words or you can order 9 medications, but obviously they didn't download the proper tables that had been mandated. And defense counsel later told me that changed when he realized there had been a false statement. We did it, we didn't do it, and it's not there. He was going to have to pursue some sort of, resolution with the United States because, yeah.
So this use of the False Claims Act, I want to make sure everyone understands how big this is. So there are so many potential cases out there right now involving a vendor or somebody causing somebody to submit a claim certifying that they are complying with something. And it's this cause to be presented language that's so important. Recently, we had a senior official from the Justice Department talk about cybersecurity threats and concerns. A lot of those cases are going to fall under a similar kind of legal analysis here.
That's right. And since Brendan's settlement, there have been 5 additional electronic health records settlements, several of them out of the District of Vermont and quite large. And there are ongoing investigations of other electronic health records companies. So you really open the door to a whole new area for the government, both specifically with electronic health records, but also looking at technology procurement in the healthcare space, health technology more generally, including cyber. So, yeah.
So the settlement here is really interesting, and we'll include a link to the settlement agreement. The case was settled, and for $155 million. Beyond the numbers, though, the company settled. Its founders were part of the settlement, and then some executives or some employees also settled as part of this case. And then the other part that I find interesting, as often the case, there was a CIA, corporate integrity agreement, that put in place saying that people could leave this company without penalties and go off to somebody else that maybe is a little more compliant with the law. This settlement was very unusual in so many ways, right, Colette?
Yes. The Department of Justice lawyers and the team at the Department of Health and Human Services, and this went up to the assistant secretary level. I mean, the decision to intervene in this case and pursue it was at a very high level within, both agencies, DOJ and HHS. And once they took it on and they were pursuing it, they really wanted to create a path-breaking corporate integrity agreement and to hold individuals accountable. And almost all of the EHR cases since then, particularly the ones coming out of the District of Vermont, have included an element of individual accountability, payments from somebody who either because they're the CEO or because they participated in the fraud in a significant way, as well as this remedial corporate integrity agreement where they're under supervision. And as you said, providers, doctors are supposed to be allowed to leave the software free of charge, go elsewhere, and entitled to fixes of the software. So, and we've fielded dozens of calls from doctors about the eClinicalWorks software, and we've sent them to Office of Inspector General since then. They wanted it to be a big earthquake within the industry, and it had a huge impact within this industry. Big wake-up call. Yeah.
And Brendan, this all happened because you had the courage to step forward. Looking back on the last over 10 years, right? You reached out in 2011. What are your thoughts about the case and your journey?
It was the hardest thing I've ever done, particularly when it impacted my private life. There's been so many bumps in the road along the way, because you get blacklisted. Then when my name was exposed after the first case became unsealed, the job started to dry up. And it's amazing how you're labeled, by companies to say, "Oh, he's a whistleblower. I don't want to bring him on board." So it was profoundly hard emotionally. Seeing my wife so sick as well, I was worried that I wouldn't be able to support her. I wouldn't be able to meet payments, mortgage payments. So it was really hard. But even the second time round, I just said, let's give it a go, because I did go up to Vermont to meet, Owen and his team, and I realized how determined and focused they were. It encouraged me a lot. And, it worked out in the end. And I would have to say I'd have to do it again. It's just me, it's just me. But I would like to say people have to be aware of the dangers of when they go into a doctor's office. It's not the doctor you should be afraid of, it's the system, I mean, I just showed you, for example, Annette. And then there have been cases where I was in Boston Children's Hospital and I was physically in the clinic, and a nurse rushed in and said, I have to call the pharmacy because there was a prescription for a 2-year-old child. And by the time it went to the pharmacy, it was the dosage for an adult. And now, how many cases like that are there? We don't know. And I feel bad too for those people who really English is not their first language. They're going to just fill that prescription or take that prescription and give it to a child or to themselves. And then, there's other aspects of the safety aspects of the system. Like I learned a great deal at Rikers because about 48% of the population are, be treated for mental illness. And a lot of them are on psych medication. When you're on psych medication, there's a flag in the system to say, an alert flag to say, this patient should be housed in cooler buildings or air-conditioned buildings because their body reacts to heat when you're on psych medication. And, and there's been instances, you saw them in the press, Jerome Murdo, who was a former Marine, 54 years old. The poor guy was cold one night. He went into a project, and just to get warm, he was sitting in the stairs, and somebody called the cops, and the cops have no choice but to bring him to Rikers. Now, he's already in the system. Now, they put him in hot, heated condition. That poor man died during the night because the heat in his cell was all pipes and was 110 degrees. And so, let's just give you an example. But then there was another case where, like, going back to that NDC code, their system, the compendium, was out of date. So a prescription that a doctor looked at the system, says, oh, that's good, I'm going to order that. And by the time I went to the pharmacy, the guy filled it and picked it up. He was found unconscious because the wrong medication was prescribed because of that NDC code error. So these are very, very serious issues. All I suggest, and I recommend anybody, when you do go to a doctor's office, ask for an unfiltered summary of your visit. Unfiltered, because then that's going to give you all of the medication, what your diagnosis was. Look at that, and then when you go to the pharmacy, pick it up and look at it against what you're getting, just as an alert. Yeah. So, yeah, and I when I see that, if there's some vendors out there or some clinics out there that are considering and getting a EHR, look into the fact that, has anybody ever been, is there a case against them for wrong certification? Run as far away as possible. Also, if you find that there's a lot of doctors that are giving you a call to say, oh, I believe you're going to go for this vendor EHR, I recommend them. Again, run the other way, because that's a crime. It's a kickback. Annette can explain that more than I can. But so there's stuff like that. And if you look at everything in its totality, between medication and labs, boy, that's a serious. That is dangerous to patients throughout the world.
Yeah. So I should mention some of the Brendan's case really led to very significant legal developments. I mean, first of all, EHRs are now one of the top healthcare fraud enforcement priorities for the Department of Justice, right? And they have intervened in multiple cases, and they have found, just like Brendan's saying, kickbacks rife in the system and all kinds of issues around certification fraud. So that has occurred. But in addition, Congress held hearings and passed new legislation through the Cures Act. And now EHR companies are required to report significant patient safety issues. Does it happen all the time? No. But are they required to do so? Yes, they are. And there are other reforms as well. And they have to annually certify that their system works properly, which helps us with enforcement, because if there's false statements about that certification, they can be enforced. I mean, the unfortunate part here is, look, electronic medical records are potentially a wonderful thing. They could potentially just reduce medical errors, lead to higher quality of care, for sure. But what happened here was Congress threw out billions and billions of dollars very quickly and said it had to be spent very quickly. And you had folks from the software industry, from the tech industry, all of a sudden in healthcare. That's partly why you see so many kickbacks, I think, and they're kind of, you can put it out in the field if it's beta. That might be okay if you've got a food delivery application or, something that's not that important, if it glitches, whatever. But healthcare, obviously, you really can't have errors. Or you have to, the other thing is the government's required the EHR companies to tell customers about the errors, so they're watching for them and have workarounds. But that mentality is unfortunately a lot of what we've had to address through these cases. And we'll get there,
Yes.
But it's going to require a lot of enforcement and oversight.
The timing of this is so interesting to me, right? This case settled 2019, if I have that right.
2017.
2017. So, this is before the pandemic, in which our country and our world increasingly relies on our healthcare providers, but they can only be as good as the information they have, right? So they have a dashboard that they're flying the plane with that has incorrect information. It leads to horrible things that Brendan was talking about. So I hope this shine a light. And you raise up a good point, Colette, the influx or the inflow of private equity. And this was a privately held company who obviously had profit as one of its main goals, oftentimes perhaps above patient need. And it just really shines a light on the concern that hopefully a lot of people now realize, we have to do a better job of going after these people that maybe are jumping the rails. So, Brendan, I just want to acknowledge you. Your story really touched me on so many levels. As a father, as someone who has had family members go through the prison system, someone who is married to a physician who relies on electronic health records daily. It really touches me.
Thank you. I appreciate that
the courage you took to step forward. I hope that I know that you have made this country a safer place. And I just acknowledge you for your courage and your tenacity. Thank you so much for joining us, Colette and Brendan. Next week on the next episode of Fraud in America, we're going to interview another whistleblower and his or her lawyer. You're going to wait to find out. That'll happen next week on the next episode of Fraud in America. We hope you enjoyed today's episode of Fraud in America. Today's episode was made possible because of the generous donation of longtime TAF supporter and whistleblower attorney David L. Herron. If you believe you have witnessed fraud against the government or fraud on the financial markets, we encourage you to visit our website at taf.org, where you will find a directory of member attorneys who represent whistleblowers across the country. On our website, you will also find additional information about our nation's various whistleblower laws and programs and a way to donate to our organization as we step forward in spreading information about whistleblower programs. This episode was edited and produced by Rachel Brooks, and our theme song is by Connor Chaos. A big thank you to our TAF staff and researchers of James King, Emma Bass, Jackie DeMar, Kate Scanlon, Max Boldman. Fraud in America is a project of Taxpayers Against Fraud Education Fund. The opinions expressed on today's show belong solely to the guest and are not necessarily endorsed by the organization. Thank you for joining us on today's episode of Fraud in America.